Hi, everyone. We'll begin shortly. We're just waiting for a few more folks to join us. Thank you. Hello, everyone. I'd like to welcome you all to this fourth program in our Vanderbilt COVID Commodore Classroom series, Science, Politics, and the Pandemic. I'm Lauren Oberstedt, Executive Director of Vanderbilt Alumni Association, and I want to thank you all for joining us for today's discussion. We are honored today to have distinguished faculty panelists with expertise across the spectrum of today's topic, as well as esteemed moderator, Dr. Jonathan M. Metzl, the Frederick Rentschler Professor of Sociology and Medicine, Health and Society, Director of the Center for Medicine, Health and Society, Professor of Psychiatry, and prolific author, including his newest book, Dying of Whiteness, How the Politics of Racial Resentment is Killing America's Heartland. Thank you all, and now I'll turn things over to Dr. Metzl to begin our program. Dr. Metzl.
Well, thank you so much. I'm honored to be here to lead this discussion among such a great and esteemed group of panelists. And I just want to welcome everyone and say hello to all the students, all the parents, all the Vanderbilt community people who are out there. To be honest, it's hard to be doing this kind of stuff in a pandemic. I wish we were all in the same place having this conversation in an auditorium or a room, and then we could have some nice sheet cake and punch afterwards. But Zoom is what we have right now, and so I'm also grateful for the opportunity to build all this. What we're going to be talking about today is really the crazy state of the world right now, and how we got here, and what we can do about it. If a year ago or 6 months ago, I would have told any of you that there's going to be a virus coming down the pike, and it's a virus that none of us, by nature of being humans, have a natural immunity to, and it's got some pretty bad outcomes. You would have been afraid. And if I would have also told you that this virus is coming, but that there are some pretty straightforward, generally agreed upon public health measures that could be taken to maybe mitigate the impact of the spread of that virus on our community. Things like buying a mask, which you might be able to get on Groupon, a pack of 6 for $19.99, or washing your hands with soap that costs about 5 cents. The hardest part, of course, staying away from other people 6 feet away, because the people you know and love and aggregate or congregate with can also become threats. But these things, ultimately, if you just add them all up, cost less than $4 probably. And that's something that if we all do these steps together, we would be following the advice of public health people. And public health people have warned us before about what we can do to join together to make our world safer. And everything from, secondhand smoke is dangerous, and wearing seatbelts in cars will save lives. And so if I would have told you that 6 months ago, you'd be like, yeah, that sounds pretty good. Masks, who really cared about a mask 6 months ago? Jump forward to now, and we're in a situation where it just feels like we're having a hard time agreeing on anything, right? In a way, there's all this information out there, all this misinformation out there, and even the most basic staples of agreement about how to handle this horrible pandemic, things like masks, or just the idea of public health itself, have become polarized, politicized. Some people do them, some people don't. Some people get their information from one source, other people from another source. And in a way, what's happening is that the stakes are really high, and we're really left with these very basic questions of, what do we do? How do we go from here? What is knowledge, and how do we really think? Who's an authority? What information can be trusted? And that's really what we're going to be talking about today. And as I mentioned, the stakes really couldn't be higher. Right before this panel, we learned that the death toll of this pandemic is probably even higher than we realized. The New York Times and Washington Post are reporting that there's probably over 200,000 deaths from this horrible disease so far. And of course, there's the economic issue about how do we reopen our communities, how do we reopen our businesses, how do we go back safely to school, how do we start college. And so I think that really this is a moment where you would think that we would all want to be kind of going the same direction, and instead what we're seeing is we're coming up against these issues that are really putting public health at odds with the polarizing politics of the United States. Now, I'll just say very quickly that this didn't all start 6 months ago. There's, of course, a long history of polarization in this country that's been building, particularly over the past couple of decades. I've seen it myself in my own research. My book, Dying of Whiteness, that you just heard about, in part was a story about the Affordable Care Act. I did a lot of research in Tennessee, and I went around and I talked to people about, hey, here's a new program that's basically going to pay for your healthcare. How do you feel about it? And I kind of saw a similar dynamic in a smaller scale to what we saw with masks. I'll never forget that when the Affordable Care Act first came out, I did all these focus groups with Griffith, who is going to be speaking here in a moment. And in the beginning, when the Affordable Care Act first came out, everybody said, yeah, that sounds pretty great. Healthcare, it's great. We need healthcare. And then the polarizing machine of the United States started to take over, and all these tensions about government, about race, about racism, about what we call zero-sum formulations of relationships, basically saying, don't do this because somebody else is going to benefit and you're going to get screwed over. And what we saw in our research was that within just a couple of months of the Affordable Care Act came out, people who had initially thought that, oh, yes, this is great, all of a sudden were doing what they do now in parts of Tennessee and Missouri and other places, which is literally rejecting their own healthcare now during a pandemic. And so these have been building for a long time. And really the pandemic is just heightening these national fault lines for us, fault lines about economics, about geography, about education, about race and racism. And we're really at an existential moment, I think, in our country, which is this moment of, where do we go from here, right? Do these fault lines become more wide? Do these fault lines tear us apart? Or do we work together during a time where we really need to? Because even now, nobody still has immunity to this virus as a species. And we're not safe as a community until everybody is safe. And really, the time has never been greater for us to agree as much as we can on a way forward. And that's really what we're going to be talking about today, is where do we go from here? I would say that we had a lot of great questions come in. This was, I think, a great example of audience participation, where in advance of this panel, Vanderbilt asked people to submit questions. And we got literally hundreds of questions, which the panelists have all had a chance to review. They're going to be speaking for about 5 minutes. And they're going to talk a bit about their own research, their own take. They're going to try to work in some of these questions. And then we're going to come back and talk a little bit about the broader questions using these audience participatory questions, and we'll have time for some Q&A as well. But I'm delighted to introduce our great panel now. We're going to start by hearing from my friend and colleague, Derek Griffith from Medicine, Health, and Society. He's a professor of MHS, and he's also the founder and director of the Center for Research on Men's Health at Vanderbilt, and his research focuses on really developing strategies for achieving racial and ethnic and gender equality in health. He collaborates internationally and looks at things like health equity, institutional racism, racism as a determinant of health. And importantly, I think for this conversation, Derek's also done a lot of work at what's called kind of targeted messaging. In other words, how can you get people to understand health messages, and how can you get them to participate when those health messages maybe seem counterintuitive or counterfactual? Next, we're really so honored to be joined by Amanda Little, who's a writer in residence at the English department and teaches courses on investigative journalism and science writing. Amanda's writing recently has been really, I think, vital about addressing another big issue that intersects with this pandemic discord, which is the issue of climate and climate change. She writes about it for Bloomberg in a regular column, and she's also the award-winning author of a book, The Fate of Food: What We'll Eat in a Bigger, Hotter, Smarter World, that looks at questions of food networks and food delivery systems in relation to climate. She's done just tons of writing all over, great outlets. I'm sure her last book was Power Trip, which was another fantastic book about energy in the United States. And we could just spend the whole hour going through all her great stuff. So just look her up. Next, we'll hear from David Wright, who's the Stevenson Professor of Chemistry. He's also our leader as Dean of Research and Graduate Education in the College of Arts and Science. And he's also the former Director of Laboratories for Innovation in Global Health Technologies. And he really looks at health delivery and low cost point of care diagnostics, working in the United States and across the world, and particularly using nanotechnology and mobile health platforms to create innovation for increasing the use of diagnostic tests and lowering their costs. And of course, that's important now because diagnosis and cost and all these factors are hugely important for COVID, but also, of course, because this question of technology is so important for not just for cost and diagnosis, but also for information and information systems. And last, we'll hear from John York, who's the Natalie Overall Warren Professor of Biochemistry and the chair of our Department of Biochemistry. He is an international leader in the field of cellular communication. His discoveries of pathways involved in organismal signaling networks and metabolism have led to new paradigms in the field and further understanding of the pathophysiology of disease. And he's also really truly a leader in curricular development and innovation. So it's not just about all of these fantastic biochemistry, the science of biochemistry, but also how do you train the future leaders and build obviously a very successful department, but also a field of scholars entering into this field. So with this, I will turn it over to Derek, and then we'll come back. Everybody's going to talk for about 5 minutes. Then we'll come back and we'll all hang out and answer some of the great questions. So Derek.
Excuse me. Thank you, Jonathan, for the introduction and for the opportunity to join you today. Let me just jump right in. I'm actually going to talk and kind of riff off of a project that we have that's funded by the Robert Wood Johnson Foundation now. I'm co-principal investigator with Consuelo Wilkins on a project looking at trust in medical care. And so we are exploring this really through the lens of African-American men, but it sort of raised a bunch of other questions for us about these concepts of trust. This was well before the COVID pandemic has hit, but a lot of the concepts that we were grappling with have really become such a foundation for the conversation we're going to have today. So what I see is that the pandemic has really illustrated for us, a fundamental conundrum in public health, that we've tried to promote trust in public health, in health systems, in medical care, because it is a fundamental and necessary foundation for people to seek the kind of care that we need, to follow the advice of medical and public health professionals. We need them to have that kind of vulnerability because none of us who are not, trained public health people or trained physicians or trained health providers have the expertise that folks who are trained in these specialties have. So there's a level of vulnerability that's inherent in not having that expertise that we have to build on and trust in to be able to seek the advice and to follow that advice when we don't have all the information and have all necessarily the tools to be able to come up with our own sort of solutions with the same level of information that other folks do. But what's happened is historically, when we've tried to understand trust in public health and trust in medicine, we've tried to just basically promote health. What can we do to help people to have faith in a system like medicine and public health? How do we have better faith in your doctors that they're going to do the right thing for you and so forth? But what the pandemic has really shown us is how intertwined medicine, public health, and our local, state, and federal government systems are interconnected and intertwined. And so it's been really difficult for people to disentangle these different systems and to separate their beliefs about and their reactions to public and medical health advisors, experts, and so forth with the government systems that are actually then put in place to implement those particular findings and that information and to apply that in our particular context. So this idea of trust has become really fundamental to whether or not people are willing to follow some of the things that Jonathan talked about, Dr. Metzl talked about in his introduction, about basic things like just how things like wearing masks, the idea of social distancing and all of those kinds of things. Should, restaurants and businesses reopen and so forth, and will people follow the guidance that's out there? And so a lot of these things have really, taught us that it's really how difficult that is. I think a second sort of key foundational point is that a lot of these systems we know are, while we try to promote trust as a positive thing, we have to deal with the fact that a lot of these systems have not necessarily shown themselves to be trustworthy. And one of the things that is important is to recognize that there is this history of, public health systems, whether it's examples of things like the Tuskegee study of untreated syphilis in the Negro male, other folks from the US Public Health Service doing studies in Guatemala and elsewhere of clinical trials to basically try out vaccines in different places and to do things to people that are not necessarily in their best interest, but are in the supposedly broader interest of science, of trying to understand different things that will hopefully be beneficial to everyone, but are not necessarily beneficial, and certainly not beneficial to those who are participating in those particular studies. And that we've seen people sacrificed in those kind of contexts. The women who are in the studies of drug trials in Guatemala, the African-American men who are in the trials or who are just being studied for the long-term effects of syphilis in the United States. But we know that people being part of these things, and those things were often framed as clinical care, or they framed them in ways that were just dishonest, that we're then expected to trust those same systems when those trust systems have not been necessarily trustworthy or worthy of our trust. We know there are vast differences in the quality of care that people get by race and by other factors, sexual orientation, identity, and so forth, that we also have to acknowledge. So when people don't trust a system, we treat it like that's the problem, as opposed to the problem being the fact that the systems have demonstrated that we should not just blindly trust these systems. And so that as a foundation for then trying to follow the kind of advice that we're getting, and the conflicting advice and conflicting information that we're getting just from the public health community, never mind the larger media sources and all the tensions that we get from those groups, but just the sheer fact that we're getting such differing views over time and just from different sources within our medical and public health communities suggests that we need to really better understand how these things play out and why things like trust are so difficult for people to follow. So one of the basic sort of terminology things that we grapple with in our work is this idea of promoting trust versus distrust versus mistrust. And while in certainly again, in public health and medical literature, we tend to sort of use them almost synonymously or as antonyms and synonyms, they're actually really different. And so promoting trust is just promoting, that you have faith in something, that you're willing to be vulnerable and then not, have all the information, but you're trusting that you're having the faith, the confidence that somebody else who has that information, has that power, is willing to do the right thing in your particular instance. Distrust is the idea that there's an object that you're basically ascribing some level of faith in when you don't necessarily have that information. So whether it's a public health professional, whether it's a politician, whether it's a doctor, whether it's some other kind of medical professional, but there's somebody that you're actually trying to look at and better understand whether that individual or that system or that object, whether that particular provider is what is worthy of your trust, and therefore you should follow that particular advice. And then the last one is mistrust, where there's not necessarily a direct object, but you just have this sort of skepticism and worry about, whether or not I should have faith in these larger systems. And initially we looked at that through the lens of race. We've certainly seen that people across racial and ethnic lines have had these concerns about whether or not they should trust, and they certainly have expanded way beyond that into political realms and so forth that we also need to consider. So let me just stop there, and I look forward to further conversation. Thanks.
Jonathan, should I jump in?
Go right ahead, please.
Okay, thanks. Derek, those were such interesting comments. I'm really honored to be a part of this conversation. It's an important one. And I am just dazzled by my colleagues and all that they have to bring to this conversation. And thank you, Jonathan, for your very generous introductions. I am interested in, as a professor of journalism, how the media, and in particular science writers, earn trust and foment distrust and mistrust that Derek was just talking about. I'm interested in how the COVID pandemic has exposed the crisis of misinformation and the way that social media platforms in particular, blogging and microblogging platforms, have intensified partisanship and the distortion of facts in the news media. We've really begun to think about a public health imperative of addressing the crisis of misinformation. And we've begun to see how these social media platforms have become vectors for conspiracy theories during the 2020 pandemic. And it's helped us kind of think about that as it relates also to climate change. We saw it during the Ebola outbreak in 2014. We've seen it as it relates to vaccines and facts around vaccines, GMOs, and so on. So there are a lot of different sort of areas within science that have struggled with these problems of misinformation, and the pandemic has pushed us to begin to kind of think about how do we route that out and how do we address that, both as a member of the media, as someone in the world of academia. It's a crucial conversation, and the pandemic has really accelerated it and magnified it. In my reporting for Bloomberg, I have been examining how the pandemic has exposed and accelerated our understanding of, in a very specific way, of what is so archaic and in our food system. I'm looking at the impact on food producers in the U.S. in particular, but globally, and how deeply unprepared we were in the U.S. To and well beyond that to prepare for to respond to this kind of disruption, and we're in an era of disruptions that will go well beyond the pandemic. Certainly, I have looked at climate disruptions in food systems and what it will take to build resilience in food systems, again, globally and in the US. So a lot of what I had been reporting on and researching for my book, The Fate of Food, how do you build resilience in food systems, build sustainable systems that can respond to disruptions, has become very relevant now. A lot of what I'm reporting on for Bloomberg in terms of the pandemic impacts on whether it's meat production, crop production, and so on, and supply chains, archaic supply chains, how they need to be re-engineered to deal with these kind of disruptions, is very relevant to the work I was doing in looking at climate and food systems. So I found that the discussions around what does resilience look like? What does it look like in the media? What does it look like in food systems? What does it look like in academia? It's so important that we're looking at this now. David Wright has been on the front end of building and bolstering science writing and communications courses at Vanderbilt, which I think is also very much a part of the same discussion. How do we educate young scientists to become better communicators, and likewise educate young writers and students focused on media to become more influent in talking about scientific phenomena. All of that is so relevant right now as we talk about COVID and its impacts on our society. And I'd be very happy to discuss any of that in the Q&A, but I will pause there.
Great, David?
Thank you, Jonathan, and thank you everyone for joining us this afternoon. I want to talk about a slightly different perspective of the pandemic, and I think one of the things that I think is interesting to talk about is how we all feel that we've lost a sense of agency. How do we know what we can know? How do we know what choices to make? How do we know what's safe to do or not safe to do? And I think that these issues have really come to the forefront as a result of what's happened over the last 8 months. At the end of January, I was in Seattle when the very first cases came to the United States, and I was at a meeting, and there were all these emergency sessions. They were talking about what was happening in China. We had presentations from people that were on the ground in Wuhan and who were looking at the genetics of the virus as it was moving around the world, even in those early days. And it looked like it was a pretty scary thing. And when I came back to Vanderbilt with some help of colleagues through the program for communicating science and technology, we decided that one of the things we should do, because it was very clear at that time that an elderly population was at risk, was to go out into the community, into nursing homes and assisted living centers, and just explain what we knew then in February, which was almost nothing compared to what we know now in August. And I was in my office the other day, which I hadn't been to for very long, and I found a thank you note that had been sent to me. And the thank you note said, you know, we appreciate you coming. We're so comforted to know that our scientists and our government will keep us protected and make progress on this problem. I can say that today that at least half of that is true, but that's my own personal bias. I think that there are three things that the pandemic really has given us an interesting snapshot of. One is the actual scientific process and why we should have faith in the value of the information that scientists bring to the table through the scientific method. I think the second thing is that it has placed the importance of common sense and critical thinking skills for every person who participates in society at the forefront. Okay? And masks is a really good example of that we can talk about later. And then the third thing that I think that the pandemic crisis has showed us is that there are real challenges with how leadership works across organizations, science, local, national, federal levels. And that's also something that each and every one of us, by participating in a participatory democracy, can have a handle on. And so even though there are things that at times it feels like this is way out of control, everybody needs to think about what they can do individually, because this is one of those instances where your individual actions will make a difference.
Wonderful, thank you. And John?
Hello, everybody. I will echo the comments of my colleagues. This is a tremendous honor for me to be part of this. And I am also, as Amanda pointed out, dazzled by not only you as alumni, but my colleagues here at Vanderbilt. I've been at Vanderbilt about 8 years, and I am what you would consider a basic scientist, not in an intellectual sense, but in a discovery sense. We often use curiosity to drive our programs. We have 27 faculty in the Department of Biochemistry and about 120 faculty in the Vanderbilt Basic Sciences group. And the one thing that we all have in common, even though we do very different types of research and approach the problem in that, is that we want to know how something works. And the way we actually come up with understanding is a reductionist approach. We come up with a hypothesis. We may come up with 8 different hypotheses about some aspect of science, and then we use a very systematic and methodological approach to understand, if we take something away, we put something back in, can we actually ascertain whether our hypothesis was correct, and use that evidence to then derive new types of ideas and experiments. And what really fascinates me of the conversations, I've been doing this for about 25 years now, is that in the mainstream public, we can talk about things like your genetic code, your DNA. I mean, Sony, the TV company, says, you know, when they're advertising their new TV, it's in our DNA. Well, our DNA is fascinating. It is a genetic material that we pass along. But guess what? We only know what 2 to 5% of that genetic code really does at this point. And if you add on top of that a factor outside of the genetic material called the epigenetic code, it's even more complicated. So when we describe in science what we're trying to do, it's an evidence-based process that we try to seek the truth. And the truth at this point is very incomplete knowledge of the system. And even though, I mean, I think back to the early 1900s, when the flu pandemic hit the population, the world population, we did not know what a virus really was. We didn't know its molecular nature. We now have atomic resolution structures of what a virus looks like. It kind of looks like a soccer ball. If you've ever seen the pentagons and the hexagons on a soccer ball, that sort of patchwork is really the basis for the shape of a virus. But guess what? Each virus has its own little tricks up its sleeve. And so as we try to understand how things work, we try to present that to the public. And that is the beauty of the peer review scientific process that I have grown to love in my life. It is full of views that are not necessarily all unified. And so we use that process to then come to understanding of the truth. And so we earn the trust by this transparent dissemination of that knowledge. We listen. And of course, we try to be honest about our results. Science and our colleagues are incredibly high integrity individuals. And one of the things that I've also learned is that there is applied science when you're trying to solve a certain problem, but the notion of a discovery science and a basic science is that we don't necessarily have a deliverable in mind. We are trying to gain knowledge and understand how a system works, and that may or may not be useful. I can say in my career, I've studied things that I did not think were going to work. When Jennifer Doudna was studying how bacteria fend off the flu, she discovered something fascinating about the immune system of bacteria. And it turned out there was an editing system in there called CRISPR. And you may or may not have heard of CRISPR, but this editing system came from understanding how something worked. And then the application beyond that was not expected. She did not start these studies trying to learn how to do editing of DNA. She tried to understand a problem. So with that, I think that, there are many examples in front of us with the pandemic. And certainly as we train the next generation of scientists and colleagues, we have this basic and discovery science roots. I think that it has exposed a tremendous number of discussion points for the lay and the informed to come up with a path forward. And together, there's absolutely no question that I think that we will learn from this experience, and collectively we will get to a point where life can get back to at least some point of normal. At least I'm looking forward to that. As you can see, my dog in the background is snoring. I don't know how many more days of this I can take. But I just want to say thanks again for tuning in, and it's an honor to be here.
Wonderful. We also want to hear the dog's perspective. We all want to get back to normal here. So
hey, what do you think? Yeah, she opened her eyes. She'll close them right back, though.
Okay.
I think the dogs will be just destroyed, deeply depressed when we all head back to the office.
There's going to need to be dog therapy, because the separation anxiety that this little pup has is pretty dramatic.
Well, listen, everybody, thank you. Fantastic comments to everyone. This is a great jumping off point for our conversation. We're now going to move back into a bit of a Q&A perspective here. And I guess there's so many kind of common threads here, but one kind of uber question, I can't help but think, I was interviewed I've been doing a lot of work with the local Tennessee newspapers and TV over the course of this, and I was being interviewed by one of the Nashville TV stations, and the guy basically said, you know, we all understand mass health, but is it even reasonable to expect people to change their behavior? Like it was a genuine question. Can we even expect people to change their behavior? Or can we even wear a mask or do social distancing? And I kept thinking, like, think how weird that question is in a particular way, because you know, cigarettes, for example, people who smoke cigarettes often find them very pleasurable, and the transition from everybody can smoke who they want to. If you look back at medical journals from the 30s, there were doctors smoking in ads, to getting people to not only stop doing this thing that were pleasurable, but also to understand that their smoking cigarettes had an impact on somebody else. And now try going into a restaurant and lighting up a pack of cigarettes, everybody will stop you. Driving down the street in the 80s, believe it or not, you didn't need a seatbelt, and then there were huge fights. Nobody's ever going to do this, and now it's weird to get in a car and not have your seatbelt on. I could go into STDs, for example, and the counterintuitive nature of putting some kind of sexually transmitted protective device on a part of your body when you are, you know, intimate with somebody. That's incredibly counterintuitive, but we do it to protect people and protect other people. So there's a whole history of public health interventions that people resist and then they accept. And so I thought there was something really interesting about the question the interviewer was asking me, because I think what he meant is, can we do this right now? In other words, is this moment different from all those other moments? Is it in us right now? And of course, right now we don't have vaccines, so we're kind of anticipating what that response will be. But I think it ties into a lot of things that we were talking about here, which is not just the nature of expertise, but the trust in that expertise, not just the nature of our institutions, but people's very valid reasons maybe to not trust those institutions because of history, because of race, because of politics. And then also just about the ways our information is conveyed right now. You can find 90 different approaches to any particular issue right now. You could, you know, the minute the vaccine comes out, there'll be 9 zillion different attitudes about it. And so I guess the question, I think, really to start the panelists is there, can we do this? Is there something particular about right now that is different or similar from those other moments in time? And really, what would it take to get us there? Anyone, please.
Yeah, I can start. I mean, I think, you know, as you said, you know, behavior change is difficult. You know, I mean, you know, if you just go on to basic other things, you know, just the idea that you should not just eat what you want, but you should eat things that are actually in your best interest and in your overall health. I mean, that's sort of counterintuitive. That why don't you just, you know, get to just consume all the great, you know, eat anything bad for you that tastes really good. I mean, just, you know, so there's all of these kinds of things that we have to do, that we've learned to do, that are in our best interest, that we realize that, you know, as adults, that we actually have to do things differently because it's part of our interest and our collective sort of good. So behavior change, you know, yeah, I think we can do it. I think part of the other implicit in the question, I think that you were asking, that you're asking now, is also, you know, is it which leads and which one follows? Is the behavior change following policy, or does policy follow sort of behavior change? And what we've actually seen with a lot of things is a lot of the changes that you were just given the examples of followed after we already went and created the policies that put the particular consequences in place for people not making those particular changes. And yes, there was resistance to those kinds of things, but eventually people, you know, decided that they were going to follow those, because often it was consequences. Sometimes it can be carrots, if you will, but often it's consequences that we put in place for doing those kinds of things. Like, you know, when we were trying to do the seatbelt thing, we would have the random stops, and you'd have the, you know, the much more aggressive attention to trying to get people to monitor their seatbelt use. And you had all of the ads and so forth around that. But I think it's recognizing, you know, that unfortunately we do have to push people in the direction that we need them to go. And as uncomfortable as that is, that those are the kinds of things that happen, and that behavior change often follows the policy changes that are in our best collective interest.
it also raises the question, what behavior change is necessary, and certainly, wearing a mask is a good example of one that we've been much more resistant to in the U.S., having had mixed messages around it. Any number of other countries have done a much better job of clear messaging and imposing those expectations for behavior change. But also there's been behavior change forced upon us by, for example, quarantine, that may be positive behavior changes. For example, do we want to maintain a less peripatetic lifestyle, a less frequent flyer lifestyle, that relies more upon home cooking and community, engagement, and sort of a localized lifestyle. And that's certainly, on a personal level, that's true for, on a systemic level, looking at potential, education systems that have become more community focused and localized, food systems that become more localized. Will those kind of immediate adaptations, persist? Are there behavior changes we've already adopted that should persist over time beyond the pandemic? And can we, in the meantime, adopt important behavior changes to resolve the pandemic? It's a really important and interesting question. And I agree with Derek. I think we can. I think a lot of the problem has been, incredibly chaotic messaging.
David, John, is there something particular about right now that we can't do something that we've done in the past?
Well, I mean, I think one of the things, I think the answer is no. I think we can do it right now. I think the fact that if you look at the advances that we've made in developing diagnostics, developing treatments, potentially moving to develop a vaccine, the rate at which the scientific enterprise has accepted the challenge is incredible. I mean, we're talking about a candidate vaccine through phase 3 trials by the end of the year, the beginning of next year. It took 8 years to get a polio vaccine to the public. And that's the fastest. And so that's an incredible amount of effort being concentrated right now to solve this problem. I do think that this is the instance where people need to stand up and I think Derek can talk about how personal responsibility messages have and have not worked in the past. But this is a message that also speaks to community in terms of how we need to behave and act today. And I think that there are a lot of approaches that can capitalize on that.
Yeah, so one of the things that's really striking to me is the idea of reducing risk. And I've heard a number of colleagues, especially during the flu season, say that, well, I didn't want to do this, like take the vaccine because it's only 30 to 60% effective in any given year. And so I thought, well, if you could reduce your risk in just about any other discipline by 30 to 50%, whether it be financial or taking a test that's multiple choice, you would do it. And so I feel like that right now, as David pointed out, we are putting an unprecedented amount of resources. And here at Vanderbilt, we have people that have been studying, like Mark Dennison has been studying the coronaviruses for 20 plus years of his life. And there are people around the country that have got more knowledge of this that is going into that system. Companies like Moderna have developed a completely new strategy to approach the vaccine. They're using the RNA as a entry point, not a protein-based system. And it's a very unique position. And they made it through the phase 1 and 2 trials because of this in record time. And that's just one of the many companies that is pursuing this. Now, on the flip side, related to trust is this transparency. We've heard a number of people say, well, we're confident, we're optimistic that we're going to have this. But, you know, there are examples like HIV where we still do not have a vaccine for HIV. We have struggled for 30 years because of the nature of the problem that we're trying to solve. So as someone who approaches the science in a slightly different manner than others, I feel like we also need to be very realistic about these chances. And so while a vaccine or something like one of our colleagues, Jim Crow, is working on neutralizing antibodies that could function to take someone who has COVID and reduce the effects of that, or, you know, you've heard of hydroxychloroquine, you know, there needs to be more studies that are blinded in the sense to determine whether there are molecules that can help slow the infection process. These are all things that the scientific process is working incredibly hard and fast to do. And to the, you know, credit of the world, there's been a tremendous amount of resources and finances that have been put into this. So yes, there's reason to be optimistic, but we also have to be very careful about how much we oversell or undersell some of these technologies.
Yeah, and if I can just jump into that, I mean, I think what John's saying is exactly right, and I think just to make it also clear that the approaches that we use in things like health communications and so forth use exactly the same process that he's describing in the science, and use the same scientific method to figure out how do we design, or we should be using the same kind of scientific method that is, you know, hypothesis driven, that is concept driven, where you're actually trying to make sure you understand not just the message, but the messenger, and that your hypothesis, you're testing whether or not these things match and are going to be received by the people appropriately who are trying to receive the message. Because part of the problem is not just the development of the vaccine. The question is, are people going to take it, and who's going to take it once you actually develop it? And that's a whole nother sort of scientific problem, is how do you actually figure out who's going to take, and will people actually take it? And will you have that, you already are seeing the mobilizing of a lot of folks, from just anti-vacciners to just other groups who are just skeptical of what this may actually look like. So we have to use that same kind of scientific method that John's talking about in both ends of this, the applied side as well as sort of the basic side of developing just these kind of tools in and of themselves.
You know, I think this goes back to one of the points that Amanda made very early on, which is this question of a crisis of misinformation or disinformation. And it's so much more complicated. You know, I think we can idealize back to when Salk was developing the polio vaccine, or the, you know, other times where the Romans were developing like aqueducts, and it's like, oh, this is great. And now there are so many different kinds of information that are coming at people. And so it's not just like, oh, here's science and that's the right kind of information, and then here's misinformation, which is distorting science. It's actually that different people have different realities, and there are different kinds of pandemics happening for people across the country. We're not just facing a COVID pandemic. This is also a pandemic of recognizing the effects of structural racism and structural inequity. People are rushing out to buy firearms in record numbers, anticipating all kinds of different problems. There's a crisis of polarization and mistrust, and so it's like there are all these ways in which everybody getting around one narrative, which maybe is a vaccine narrative or something like that, is going to require you know, I think almost like a war on polarization you could think of, and also really sustained efforts to take seriously the social factors that are leading to not just the pandemic, but the protests after the murder of Floyd and other factors like that. And so really this question of who do we listen to right now is not just one about here's the right information, here's the wrong information. It's actually like listening to people and figuring out how we can address all this. And this brings in, I think, one of the other names of the panel, which is this question about the media and the role of the media. Amanda, you want to maybe just say a few words about how maybe you think about that kind of thing, about is there really right and wrong information right now, and what the role of the media might be in terms of bridging some of these divides?
Yeah, I mean, there's clearly a lot of misinformation. There's no doubt. If you want to find information online that will encourage you to go mask-free, and you can find it, right? Like you can find whatever you want to reaffirm your own biases and whether it relates to your behaviors around the pandemic or anything else. I'm generally optimistic, and I'll just share a little vignette. When I was in my early 20s and just getting into environmental writing, I met a reporter for the Boston Globe who was covering environmental policy, and he said, the best thing that ever happened to my career was the Reagan administration, which just destroyed, environmental policies, some cornerstone environmental policy, a lot of rollbacks. But suddenly this was front page news, right? And I think you would hear something along the same lines that, from reporters like Ed Yong, who's at The Atlantic, for example, and doing incredible reporting on the pandemic, that this is reestablishing the primacy of science in an important way in our national conversation. It's also, inherently forcing a lot of us to become humble in the face of lay readers, to become humble in the face of science, to begin understanding why it's important for a government to fund science and scientific research. I don't think, the CDC, to say nothing of, the Health Security and Biodefense Unit of the National Security Council, I don't think that was, particularly like household conversation 6 months ago or, before then. So the ways in which we were all being called to engage in a conversation around science and how we bolster and support science in our communities and certainly at the state and federal level, that really wasn't as a conversation, in the among lay readers before this. So I think it's important, and that is important going forward in terms of climate coverage and our discussions around any number of other critical, scientific phenomena and public health phenomena. It is a call to arms and a call to, to engagement. And for us as educators, to really give students skills for, writing and communicating about science is essential, and to expand our curricula. And Vanderbilt, as I said, is doing a really good job of that at an important moment. I mean, the amount of, the enrollment levels in, science writing and science communication courses are off the charts. I have, wait lists in my courses now that there's a huge amount of interest among young people in looking at this intersection of, science and public health and media and communication. And so all of that, I think, is very positive. Technology has been driving this problem, right? We've seen so much discussion around what's the responsibility of, Twitter or Facebook in controlling and managing the misinformation on their platforms. And we've seen Twitter take a real stand on this. And I think that's very important. I think increasingly we're going to see these social networks leveraging algorithms that can help ferret out misinformation. And so I think we're going to be building ways, not only in terms of policy, but also in terms of technologies that can help address the crisis of misinformation. Right now, it's rampant, and we need certainly talk about it. But going forward, I'm optimistic that it will improve.
You know, we're heading toward the end here, but I'll say that it's interesting. David and I and a couple of other professors are going to teach a class this fall called COVID and Society, where we look at kind of how the pandemic is shaping the present and the future. And one of the things we're going to do in the beginning of the class is read, 2 weeks into the pandemic, Politico and other places were saying, you know, COVID will change the future, here's how. And they had 30 experts. And it's really interesting to go back and read how people thought COVID was going to change society. It was a bunch of stuff like, we're going to trust science more, and we're going to get along better, and public transportation is going to be so great. And it was this very kind of optimistic, I would say, view of kind of the changes when we're all facing a kind of common pathogen. And it turned out that that view also didn't take account of the fact that not everybody was facing it the same way. It turned out to people faced it differently based on race and privilege and structure and all these factors. And so I think we certainly have a much more nuanced, hopefully not too pessimistic view of the future. But I think that this question of how we're going to move forward, and of course the other thing we've learned is about the drivers of chaos. Misinformation isn't just happening. A lot of people benefit from it. And if you don't believe that, go on Twitter and write something nice like, I love puppies, you'll get 5 retweets. And if you say, I hate John Smith and he sucks, then you'll get 1 million retweets. And all the structures in which we're engaging with each other right now are primed to pit us against each other in a certain kind of way. And so it's also understanding the drivers of that. Now, I think we're gonna, finish up in a second here, 30 seconds each. You can answer one of 2 questions, either lessons for students going forward, or let's rethink about that Politico question about what comes next. So what do you see in terms of these issues over the coming months? Derek, why don't we start with you?
I think just quickly, lessons for students is, I think it speaks to the importance of a liberal arts education. I mean, what you're seeing is that the importance of being able to think critically, to be able to sift through misinformation, to be able to look, you know, and think logically about how somebody has built an argument or what they're building their information on, and how critical that is for just being public discourse and just being a part of society. And so that foundation that we have established at Vanderbilt, and that's a fundamental part of our education, you're seeing the value of it right now. So
great. John, 29 seconds.
Yeah, so I think for the students, I'll echo Derek's comments. You know, a broad-based knowledge and using multiple sources of information to make decisions about what you may or may not perceive as the evidence and the truth is something that I learned early on in science that I would highly recommend for all of us to incorporate into our training. You know, where do we go next? There's going to be a lot of new developments over the next 6 months, and taking the pulse of those developments in a way that is somewhat agnostic about the outcome is something that I recommend. And of course, our community engagement. One of the difficulties in this is to present complicated information in a way that everyone can understand it. And there are some people who are very gifted at that. And if you're training or you have that gift, please use it, because we need it at this point in time to help people understand the ins and outs of this very complex and mutating situation.
Great. Amanda, 24 seconds.
I'm going to try to make it 10. Number 1, vote. That is the number 1 important lesson to students. 2, interdisciplinary studies. So important. This intersection of science and humanities is where it's at. And Vanderbilt's doing a great job on creating great new curricula around that.
David, 19 seconds.
Okay, so I think for students, the thing that's going to be really important is they have an opportunity this fall semester to have agency in the outcome of their experiences at college, on campuses around the country, or remotely at home. You know, this is the chance where their behavior and their actions are going to determine how successful, how long lasting their year is going to be. And so they always say they want to be in charge. in a lot of ways this semester, the students are going to be, in fact, in charge.
So you're saying no raves? Is no rave policy?
No rave policy. That's
okay, right. All right, cool. Well, I think ultimately, I think we've hit on a lot of important topics as jumping off points. This is not just a medical crisis, a science crisis. It's a social crisis, and really, what's happening now is we're not going back to the world we had. We're reshaping a new world, and it's great to hear of all these avenues. And I think you're exactly right that this is why we have college and research communities, is to really reimagine how can we take the lessons that have been exposed now and this new reality and build a better world. So that's terrific. Thank you all. Lauren, I will hand it back over to you.
Thank you so much for joining us for today's discussion. You'll see in your chat box, there's a survey for folks to fill out, as well as please join us. You'll see registration coming soon for our final COVID Commodore Classroom on September 15th with Dean John Geer and faculty panelists for that. So thank you so much for joining us. Thank you to our distinguished panelists and for Dr. Metzl for joining us today. Thank you.